Hi everyone, it's Dr. Angela Natoli of the Chiropractic and Functional Neurology Center. I am here today with Dr. Karla Mehlenbacher. How are you, Miss Karla?
Hello.
Good. So Dr. Karla and I went to school together, and little introduction for her. Dr. Karla is a Austin native, a board-certified chiropractic neurologist and functional medicine practitioner. She uses integrative neurology and functional medicine to help people struggling with post-concussion syndrome, childhood development disorders, and chronic pain, and many other neurological and autoimmune conditions. After developing an autoimmune disease as a child and later discovery of Lyme disease, she was drawn to the field of holistic health and healing. Dr. Karla has many years of postdoctoral training, including fellowships in childhood neurodevelopment and brain injury rehabilitation, and degrees in human anatomy, biology, and clinical neuroscience. She weaves perspectives from these disciplines to support full body wellness. Her hope is to build a community where anyone suffering from chronic illness can seek wellness and feel supported by a wide variety of resources specific to the healing journey. So with that, I would like to welcome you, Karla. So let's talk a little bit. Why don't we just start? I think a lot of people haven't even heard of, a lot of people have heard of chiropractic, but not a lot of people have heard of what functional neurology is. So how would you describe this practice, this study, to patients who've never heard of it before?
Yeah, so I can speak on my personal health journey and how it led me to this, because it was not a direct route. So I, like you had mentioned, had an autoimmunity as a child. I was on the path to be a real doctor. I was going to UNT Health Science Center, and I got severely ill. And when I recognized that my resources were not aligning with what was making me feel better, I had kind of a quarter life crisis, and I was like, I want to do more holistic, like that feels right for me, and that's what's actually helping me heal. So I went to chiropractic school completely unknowing what actually chiropractic really is. So in that, and of course you were in my class, so you know, but I finding neurology and the mentors that we had really is what made me love the field. And what it is more holistic ways that we can reactivate pathways in our body. So kind of taking the concept of movement heals the brain, well, we get real specific about that, and we look at very specifically how are your eyes responding to the environment. We actually know that the eyes is the direct link into what faster movements than we do physically. So we can kind of see windows into our inner ear function, our spinal function, and of course, keeping the whole picture in mind from chemical, emotional, and physical. So it's a holistic approach to getting very specific about your nervous system, and then what can we do to entrain that system to be as optimal as it can be.
Yeah, exactly. So what were the autoimmune conditions? Tell me how you got to chiropractic school.
Yeah, so I had what's called Hashimoto's thyroiditis. I didn't know what the thyroid was. I was even pre-med in like biology major, and I was like, what's that? And so I would have very severe blackouts. I remember I used to like plan my day around when I could take a hot shower, because I had what now I know is POTS, positional orthostatic tachycardia. I didn't know at the time what that was. And then I went to the ENT because of this, and after a series of doctors, and he said, you know, you have a huge growth in your thyroid, a nodule. And I was like, no, I didn't know that. And he's like, you're gonna have to take it out. So I definitely went through the medical route of like, you're gonna have to remove your thyroid, you're gonna have to be on medication the rest of your life. I then got a shot that sent me into a tailspin, and then through all my testing, found out I had Epstein-Barr, Lyme disease, all these other co-infections that people in the chronic illness community know kind of go together. And then it was like, okay, what do I do about this? And the medical route was medication or surgery. And I was 19, like there was nothing in me that was accepting of that solution. I was also going to move to Spain the next year, and I was like, well, I'm going to be off insurance, so this isn't an option for me, the whole prescription thing. So I did my own research, and I discovered that the things that really healed me was cleaning up the terrain and letting my body detox those things out naturally, getting really in tune with my movement and my daily rituals. And we know as chiropractors how much even just posture makes a huge difference. But not only that, I mean, your thoughts, all of those things, what you're putting in your body, the chemical, it's not a simple answer. It's complicated for everyone. And for me, it took like chronic daily work to get to where I am now. And that's what I'm passionate about, is teaching people this side of how you can do it without just trying to cover up your symptoms and not really living an actually happy life.
Yeah, and I think that's important for people to know too, is that there's no cookie cutter approach to any of this. Most of the people who come to us have been to lots of other doctors, been through tons of other treatment, and there is no protocol for anybody, essentially. Everything is completely catered towards each patient.
Right, and the positional orthostatic tachycardia was probably my most severe symptom. I mean, aside from all my histamine and hives and like the chemical side of it, and finding functional neurology and doctors that could actually rehab this physically, like with movement, it changed my whole day-to-day life. Like I could take hot showers, I could drive on roads that were windy, and like all these things that I just kind of dealt with and was constantly nauseous. And like, I mean, I would have to, every time I stood up, I was like, I had to take like 5 seconds. I just couldn't do it. And getting that corrected by someone that was doing eye exercises and inner ears work was like, what is this? Like, this has to be something. And then I just like got super obsessed and was like, got really into the concussion world with Dr. Carrick. I mean, it never ends because it is all so connected and it's complicated, but it's beautiful because of that.
So let's go into POTS, because I think a lot of people may have heard the term POTS, but maybe not a lot know what that actually is. There's a whole lot of symptoms that go along with that. So describe what your experience was with that a little bit.
Yeah, I mean, with me, before I knew what I know now, from a layman's point of view, I just could not regulate where my blood was going. Like I couldn't make fast movements when I would get up from bed. Like I had to like first sit and then like try and slowly get up and then like fully stand up. And so basically from a physician perspective, POTS is when your baroreceptors in your brainstem get shifted with movement, right? That's why it's called positional. So when you move from one position to the other, there's a part of our brainstem that's like, hey, we need to get more blood to this area. And when that system is, for whatever reason, not making the connection quickly, your brain is like not getting the blood. And so you kind of have that blackout feeling, which I've actually blacked out many times. I mean, my roommates in college know, like I would just go straight on the floor because if I wasn't careful about it. And then, you know, being in college, I was like, well, I ate Whataburger, I was drinking, it must be that. I didn't really like know my body to be able to tell that that was not an okay thing.
So in the medical world, I know the POTS treatment is basically medications to help hold water in the blood, essentially, so that your blood pressure doesn't drop quickly when you stand up or when you make sudden movements or anything like that. So now you're saying that you got help through eye movements and through basically movement, chiropractic, other things. Do you want to go through kind of what your journey was as far as how you got better?
Yeah, so the basis of movement, cognitive movement in general, like the only reason we have a nervous system is because we're moving creatures. We pretty much have the similar cellular makeup as plants and trees, but they don't have nervous systems because they don't need to actually move. So when you look at it on that level, we have the baseline is reflexive. That's the first level of movement. Either we have an immediate reaction to the environment. The next level is gross motor movement. So this is kind of like posture and core stability. And all of these systems are feeding into this network of positional orthostatic tachycardia, right? It's not like this one area is doing all the work. It's a network. That's why they call it a network, because it's all these signals coming from my eyes, my spine, my ear, my proprioception. All of those are coming together and saying, this is where I am. And if those connections don't come together well, or for your brain's like, I don't know where you are, then your brain is like, I don't know where to push blood then. Mm-hmm. So it's not that it's not chemical, they all go together. Why would the cell not be flushing fluid correctly. Well, you could argue that it could be electrical input. We are electrical creatures, but you can also argue the chemical, right? Chemical turns electrical, electrical turns chemical. So by being able to say, well, hey, your ears are not actually sensing the environment well when you move this way or when you lift up, maybe we can activate that area to see if we can get more integration so that your brain knows where it is in space better, and it can then quickly make those connections and get your blood where it needs to go.
So when you say activate, so for the people who are watching what we're talking about right now, so how would we activate a piece of the brain or a part of the brain or a certain area of the nervous system?
With movement, I mean, we know directly that when we move a certain area, it activates a certain part of the brain. I mean, this has been studied to all end, but being really specific about which movements, like, do we need to do more core? Do we need to do more fine motor? Do we need to do more with the visual system? Do we need to do more with movement and vibration? You know, that underlying vibrational sense. So activation, I guess, to answer your question, is the combination of getting that nerve to become more efficient or more what we use plasticity. So whether or not that's a chemical need or a repetitive activation of that nerve. So even thought is activating a connection, a series of small micro movements in your brain.
Absolutely.
So that's what we use activating, but really you're just saying, I want this pathway to get stimulation. And then the more we can repeat that, can we create plasticity to where this is like the new normal?
Yeah, absolutely. And I think one of the coolest things when we were first in school and starting to take neuro classes and all of that is just understanding that the brain actually has maps, right? Like you never really think of it that way until you're taking really in-depth anatomy classes or neuro classes or things of that nature, that the brain has maps of every piece of your body. And to activate certain areas of the brain, you do certain things with different areas. So me moving fingers is different than moving toes versus a hip or etc. So whenever we do exercises with people, they're always going to be different for every single patient because it just depends on where that patient's weakness is, right?
Yeah, and I think a big concept that a lot of people don't recognize is that our body is our nervous system. Like it's not just like this is a separate thing than this. Like all of this has a replication of this. This is just kind of like the guy that makes it efficient. That's what we think. Like this is the guy that's like, how can we make this super efficient? But this is all the same nervous system. It's all connected.
Yeah, absolutely. So let's talk a little bit about how people at home can maybe apply a little bit of functional neurology and why it would be helpful for someone to see someone like us. So you've done a lot of work with childhood development, correct?
Yeah.
So you were saying a little bit about movement. So the first type of movement is reflexes. You want to talk a little bit about what a reflex is, and then we can kind of go into how maybe a mom or dad can check something quickly on their kids, or you know, how you could notice different postures and things like that where maybe someone needs to come and see somebody like us.
Yeah, so the basic of movement cognition is that babies are like the perfect example of what our nervous system needs. So we start out reflexive, and that's because babies they need to navigate getting out of the birth canal, they need to navigate going towards the breast. So we come with reflexes that make us just automatically have movement to the thing that we need that's going to keep us alive.
Right.
Then we see a baby start to pick their head up, they sit up, they get motor control, but it's more gross motor, it's postural motor. And then we start seeing fine motor and complex thought. So the big picture, I think a lot of people don't recognize is that they want to jump straight to the fine motor, like sit down and read, or do this thing that's really complicated for them, but they kind of are skipping the reflexive and the gross motor part and just how important that is. Like you have complex thought with complex movement. That's why we're intelligent creatures. And we are similar to other mammals, but they are more simple motor movements, so their level of intelligence is that level. So the more we can focus on integrating reflexes first, then posture, then we can discuss the behavior. But before you even get to the behavior part, how is their body moving? Are they walking on their toes? Are they scooting like army crawl? Are they able to hold a pencil correctly? Are they constantly sensitive to everything around them and covering their ears and light, sound sensitivity? Are they picky eaters? All these are early indicators that those reflexes or gross motor maybe need to be continually worked on to where we can get a better foundation so that then the behavior that we want can happen.
Absolutely. So what Dr. Carl is kind of saying is we have reflexes that help us survive, basically. Reflexes are all about survival. And then as we grow and our brain starts to develop, we don't need them as much. So those reflexes should disappear, most of them, correct?
Yeah.
So some of the things that she's talking about and you can look for maybe in your own children, like you suggested, toe walkers or not holding a pencil correctly or not crawling correctly, things like that can be indicators that possibly there could be some developmental delays or maybe just weak areas of the brain, like you said, that maybe need stimulated. So what would something be? Do you have like a case or an example of someone, a little kid that you worked on that that reflexes were really a big indicator of a problem?
Yeah, I mean, there's articles that show that 90% of kids with ADHD have some sort of postural finding. So a good example I think that we can all relate to if you've ever been around a baby is the grasping reflex. So when you hold a baby, they grab on. Well, this is needed for survival, like you said initially, to hold on to mom, you don't want to let go. But eventually you hold yourself up and you feel safe. You don't need to do that anymore. But if you are still having this is a nuisance now. Every time something touches my hand, it's a nuisance. I can't do what I want to do to control it.
Yeah.
So if for some reason this was not integrated well, or maybe it needs a little bit extra time for that kid, which is super okay and normal.
Absolutely.
And we can integrate and say, okay, why is your brain saying you're not safe? What can we do? And this is different for everyone, right? This is why it's complex and not everyone's the same. But it's an indicator to say, I want to go back and look at those things, and why can't my kid hold the pencil? Maybe he needs to work on this reflex, and then the gross motor, and then the fine motor comes.
Right. Yeah. So everything's a building block. You can't do fine motor skills until you have the other things first. And I think that's probably where a lot of frustration comes from in the healing process, is wanting to skip sections of the healing process, probably.
Yep.
Yeah, I absolutely agree. So then in the functional neuro world, what could be maybe some treatments or exercises or things that we may send home for a kid, because we're not doing drugs and surgery. Maybe we'll give them supplements, maybe we'll give them different types of support. Kind of talk about a little bit about how our treatments differ from a more conventional approach.
Yeah. I always say, no matter what findings are coming up, you have to address the chemical part of it, the physical part of it, and the emotional part of it. Mm-hmm. And we talk about this in chiropractic school all the time. So mm-hmm. I think the physical are indications of the things that need to be done with movement. And then there's also a cellular level on, are they just feeding fire to their nervous system? Are you even giving them the appropriate fuel to get the nerve to do the job? Mm-hmm. So both need to be really looked at. And I know, with functional medicine, we can get really specific about that. So maybe this kid has been exposed to something that their nervous system or their immune system hasn't been able to detox or excrete, and maybe they need help with getting that out. And then on top of that, looking for these physical patterns and saying, what does my kid need to do a little bit more of to negate any issues in high school or later on that, a lot of people wait until they actually have issues. They're like, yeah, they're fine. And that's my biggest passion, is letting them know, like, hey, you have a huge window. These kids are getting 1 million new neurons a day. It's mm-hmm. like a feeding ground for creating plasticity. And that's why I love working with kids, is because it's so much fun watching them change so quickly, because their uh-huh. brains are like ready for it. They're just like, tell me what I need to do. But if you don't know, then you're not going to know later on when they can't sit in a chair properly because their body is constantly telling them to move, or they perceive low frequency tones way too much, and so they're constantly in a predatorial state. Mm-hmm. Maybe parents are thinking, well, why can't you just calm down? Yeah. Maybe they need more integration of their inner ear. It's kind of taking the blame of the behavior away from the kid and saying, they just needed a little bit more time in these lower sections, which is we all do, even as adults. You can't just get to the top and stay there.
Absolutely.
You have to keep doing them all the time.
Yeah, absolutely. And then like you said, it's maybe not just a behavioral issue. It's probably, or it could be something in the brain that maybe needs a little bit more help, or a little bit more activation, and then the rest of the issues start to kind of calm down, essentially. But
Right.
yeah, thoughts, traumas, and toxins, right? So all the things that stress us out in our world today, we address all of those. So as far as like the mental, the thought side of it, do you work a lot with kids with that?
Yeah, the thought is more of addressing that it needs to be discussed. I'm not a psychotherapist, so I don't
Right.
do it directly. If I feel like that's a resource that they need, I'll refer for that. But just, recognizing to the parent even on how to navigate that fear and anxiety and frustration with their child, and recognizing it in a kind of like taking the shame and blame away.
Yeah, in a healthy way.
The physical tension that it causes the family. I mean, it's a huge dynamic. As you know, the divorce rate of autism is 80%.
Yeah.
So just bringing that up and saying, there are these ways to approach it, and there are ways to kind of not make the kid feel like they're broken or that something's wrong with them. And even, I don't even like using diagnosis because of that, the placebo, right? Like if you tell a kid, hey, you have ADHD, what are they going to do? Like, that's my identity, that's my excuse,
Yes.
the way I am. So if you believe you have ADHD, you do. And we know that placebo works 30% of the time, every time, gnostically and agnostically. So what you believe about yourself is your reality, and it will manifest real. So
Yeah.
bringing that up, I don't necessarily like do the deep trauma work directly,
Right.
but just recognizing that you are what you believe you are. And if you think you're going to get better, then you will. If you don't, you won't.
Yeah, and I think that's a big part of it, because we aren't psychiatrists. We don't do that, but it's a part of health, essentially, that you have to at least give attention to, because people do identify with their problems. And if a lot of times, if you give them a specific diagnosis or something, you're right, they can either take it and that's their excuse for not doing well, or they can take it and that becomes their identity, and it just manifests 100% in everything that they do, and they can't get out of that loop. So sometimes just maybe finding a weak area or a weak system and just rehabbing that is better than putting a label on it.
Yeah, and unfortunately, a lot of these diagnoses came out in like the 80s before we knew about all these systems. So we're almost trying to match our symptom checklist with previous things that were created that are like, wait, what is ADHD? Like ask any doctor, what is it actually in the brain? I would love to hear their answers, because it's super complicated. And like, maybe a new way of reframing this is maybe their body movement is not appropriate, or their cognitive movement, if you will. And maybe it's not a thing that they need to have forever. It's just a sign that they need this extra work.
Yeah, and I think that's awesome. So for the end of our talk here, is there anything else, tips or tricks that you would tell patients, especially maybe parents, to look out for if they see something in the stages of development in their child?
Yeah, I mean, pay extra attention to the milestones. I know that the pediatricians typically will just say, hey, here are the milestones, but they don't really stress the importance of them. And of course, every kid is different. So don't overanalyze that my kid didn't do this on time. Like, that's fine. They might just need extra time. But a big thing, I think a lot of just our society, not even kids, but parents aren't doing postural core work anymore. And
Absolutely.
making your kid exercise, I know it sounds bizarre, but like if you just making them do core things like yoga, or even just super simple things like the bridge and cross crawl, like those are all amazing exercises for their brain. And if you want to get more specific, you can reach out to us. But just making them move their body. The reason that they can't sit still, the highest form of cognitive control is being able to sit still. And so when your kid can't sit still, they probably need to move.
Yeah.
Your brain is asking for it, so let them move, and then really get honest with yourself about, is there something in their system that might be causing them inflammation and a chemical storm? and not just saying, oh, well, I've eaten those things forever, they're fine, and saying, well, maybe I need someone to look at this more specifically, because a lot of these kids are still building those systems, and their immune system's not super intact to be able to flush those things out as easily just yet. So it's like, look at both, and then of course, like, what are you saying to them? What are they saying about themselves? And then they're being in community and being around friendships. So all of those things, I would say, if you want to do it completely on your own, but if you want to get really specific, come talk to someone like you or I, because that's when you can really get to the root of what can we do for this child.
And catching it fast is the best thing that you can do, because, you know, rehabbing adults is a completely different ballgame than rehabbing children. You're right. It just happens. They get better so fast because they're ready. Their cells are fresh and they're new and they're ready to heal. And denying that could possibly delay their progress almost, essentially. So
yeah, I mean, they're even showing that we're still developing our pathways up through our 30s. You know, the whole thought that our brain stops developing and that's it is been a debunked myth for many years now. So we all are not in the clear from this. We can all continue to look at ourselves and say, why did I just react that way? Was that a reflex, or did I actually control that? Or why is my body inflamed? You know, like really just getting in tune with your body as adults and as children.
absolutely. And I think it's important to note that everything is very specific to each person, and there's a lot of different approaches that go into holistic healing. It's not, you know, a lot of chiropractors say, okay, you move that C1, that atlas, and everything in your body fixes itself. So I think when you practice chiropractic and functional medicine and functional neurology, and you integrate all of these different things, you're really encompassing a much wider range of health than just saying, okay, I have symptom X, I need medicine Y, and, you know, call me again when you're not feeling good. So this is kind of getting you better from the inside out, and truly better, letting your body actually heal. Would you agree?
Oh yeah, I mean, I can speak on a personal level. I was not getting better with the options I was given, and I was not willing to settle for that being the answer. So I think everyone should take control over their health in that way, and their bodies. We need to understand our bodies, and then we can heal.
Absolutely. So Karla, thank you so much for chatting with us today. Maybe we can do another video on specific movements, like you were saying, for kids, on teaching them how to move and what to do, and we can release another video for parents who would be interested in that. So anyone that is listening to us, feel free to comment, give us any opinions, anything that you'd like us to talk about. We would be happy to do that. So Dr. Karla, thank you so much for chatting with me today, and until next time.
Thank you.
Bye.